but bringing it closer to home. Just for some context, I did this little experiment this weekend as well. I think we have to realize that we are changing the course of human history with the decisions that are made. And how do I know this? There's a really great article that John sent me by Daniel Horowitz, Lost Common Sense, How America Lived Through the Asian Flu of 1957. So listen to how he starts this, and do this experiment either on yourself or with anyone else in your life. So it goes through this. Let us all keep a cool head about Asian influenza as the statistics in the spread and the virulence of the disease begin to accumulate. My goodness, a New York Times editorial from September 17th, 1957. It's not that they were unaware. It's just they said, let's just keep our heads. So Daniel goes to his dad, says, what was it like to live through the Asian flu of 1957? His dad said, what was the Asian flu? He was in second grade at the time. And Danielle says, well, do you remember the Hong Kong flu of 1968? I followed up thinking that surely he'd remember something that killed around 100,000 Americans, the equivalent of 160,000 today, when he was in college and very news savvy. I remember the riots of 68 and the oil crisis of the 70s, but I don't recall anything about flus. Try the social experiment on anyone who lived through the 50s and 60s, or try it on yourself if you're a baby boomer or older. You will likely won't recall any disruption in your life, nor any trauma-induced fear and panic. That's because there wasn't any disruption. And those were pretty dramatic events that happened at the time. So there was a professor who sadly died after writing this article. He was one of the individuals who was responsible for I think it looks like the smallpox pandemic and taking the approach in eradicating that from the face of the earth. But it says one of the things that he did, he said in 2006, 3 years prior to writing his analysis on the 1957 epidemic, the scholar is Don Henderson. Do I have his name right? I'll see if I can find it here. Henderson co-authored a paper in which he observed there are no historical observations or scientific studies that support the confinement by quarantine of groups of possibly infected people for extended periods in order to slow down the spread of influenza. That's from 1957 until fairly recently, before the medical profession was politicized. They all understood that we lack the ability to stop the spread of a flu-like virus. The best we can do is treat it without sowing panic. As Henderson warned, experience has shown that communities faced with epidemics or other adverse events respond best and with the least anxiety when the normal social functioning of the community is least disrupted. What a shame. Henderson and the common sense that defined America are no longer living. So think about that, friends. Like, think about where you were in, 68? When Woodstock happened? Can you imagine? We would have what Woodstocks are we not doing now? What major events in the world are not going to happen because of this unique approach that has been taken?
Okay, it turns out the source of all the information read on Daniel Smith's show is this man, Daniel Horowitz. He's employed by Conservative Review. Let's look at his biography. He's a senior editor at Conservative Review, used to work at The Blaze and Breitbart, Red State, Red Meat Conservative, and the Federation for Immigration Reform. So most of his resume is conservative blogs. And under education, it says none found. I don't know. This is just the source that I found. I couldn't find any degrees that he has. He's definitely not a doctor, and he definitely does not have any medical experience. But he does have a Twitter account. His Twitter handle is RM Conservative, I suppose. And he is a regular guest on regular radio programs such as Hannity, Lauren Ingram, and Steve Deese. So here he is on YouTube talking to Ezra Levant's YouTube channel, Rebel News, about the wedding cake ruling. And here he is on the Glenn Beck show talking about Baltimore. And here he is on America Can We Talk. America Can We Talk being a YouTube channel that recently aired some claims from Richard Bartlett that claimed that inhaled steroids were more or less a cure for coronavirus or COVID. And here he is talking about race with Steve Deese and also talking about COVID on One American News Network. And here he is being fact-checked by the Arizona Republic after he claimed that 10% of Arizona's public schools were undocumented children, which turns out to be incredibly false. But let's get back to his coronavirus claims. Here is Daniel Horowitz saying that Sweden is riding high because of the triumph of the rational herd immunity approach, which is rather strange. And it's strange because Sweden has multiple times claimed that they're not pushing for herd immunity as a goal, as we can see here. It's not been an official goal of the Swedish Public Health Agency. And Sweden is very far from herd immunity. So this is, again, Daniel Horowitz is not a doctor. He's not citing any particular information. And he is directly contradicted by Swedish health authorities as to what Sweden is trying to do. And we'll get into more about Sweden in a moment. But let's first recap on some of the YouTube videos with Daniel Horowitz and talking about the coronavirus.
Right? You're in the same boat. So
yep.
Tell me, how confident are you on a given day when you write an article or do a podcast for your audience that everything that you just put your blood, sweat, and tears into breaking down and analyzing for them isn't going to be debunked tomorrow, a week later, a month later? It's really making doing this job as hard as it's ever been for me.
Steve, this is the days of judging the judges. I mean, that's what it is. It's pure anarchy. It's anarchy not just in the streets, but in the academic world. It's not as hard as you made it out to be. And I think you know this, Steve. We talk about this a lot together, that the reason why you and I often get things right where so many smart people, whether it's a financial issue, whether it's a military issue, which we both don't have military experience, whether it's a scientific or medical issue, we get it right where so many of these professionals their whole lives that were in this industry or those industries get it wrong is precisely because we're political guys. Because all of these issues, when you see a coalescing, a sudden, incessant obsession about something, social distancing, mask, racial injustice, you know it's wrong. Okay? Because you know it's political, Steve. It's a political issue. It's not a scientific issue. It's not a criminology issue. It's not a military issue. You know where it's coming from.
Joining me now from Baltimore, Maryland, senior editor for Conservative Review and Daily Ledger contributor, Daniel Horowitz. Daniel, more testing is going on. When you start looking around for a bug, you're going to find a... Imagine if we did all this testing during the regular influenza season, looking around for the flu, how many millions of cases would suddenly spike in this country. We're looking for it. We're going to find it. We're also testing in hotbed zones, in areas that are going to necessarily show more positive cases. Those are jiggering the numbers. But it's also common sense, is it not, Daniel? When you lock people up for 3 months and then you set them loose, and there's a virus out there, they're going to get the virus. But part of your research, what I find fascinating, is the numbers. And we'll get a little bit into the numbers in a moment. But in general, the numbers are warped. They can't be relied upon. You're finding case after case after case where they're double or maybe triple reporting, I don't know, a single case.
Sure. I mean, this is the ultimate accounting gimmick. Look, what you're seeing in Florida is what a flat curve looks like. It's drawn out a little bit longer and very few deaths. Think about this. I bet your listeners wouldn't even know this. Over Saturday, there were 34 deaths in New Jersey and 25 in Florida. But here's the deal. Florida is supposedly finally getting their first iteration. They barely had anything. New Jersey, even after suffering so many deaths, 11 times per capita more than Florida, they're still, even after they're over the hill, so to speak, still having more deaths than Florida. So, I mean, that's number one. But here's the broader thing. We had a major debate in March. Our side said, look, this virus is widespread, has long spread like the flu, and the good news is, therefore, the infection fatality rate is so much lower. The cases you're seeing in the hospital are the only serious cases. Everything else is either asymptomatic or very mild. So outside of nursing homes, this is really not more deadly than the flu, or certainly a bad flu season. Now we're finding the virus has weakened even further. So there's almost no deaths, even though there's tons of cases. And yet the media is like, hey, look at all these cases. We're going to die. And they're missing the point.
Right.
One other thing, Graham,
Yeah.
with the hospitalizations, as you mentioned, it's an accounting gimmick. When my wife had a baby in a Maryland hospital well into April, she was not tested. I certainly was not tested. Now every living organism that goes into a hospital is tested. Earlier on, Florida, Texas had nobody in the hospitals. They had no COVID patients, but then they had no one else because everyone was scared to come in. Now that they're back up to snuff, the same ratio of people that always had it, 10, 15%, now have it once they get it. That is designated as a COVID patient, even though they never came in to get treatment for the virus.
The hot spots right now, if we look on the map, there they are circled. You're looking at Arizona, southern Arizona in particular, southeastern California. You're looking at Houston, parts of Texas, and maybe parts of Florida. That southern zone. What is all in common with these states? That would be southeastern California, Arizona, and in particular, Houston. Oh, it's this crazy thing called the southern border.
And guess what? You threw in Florida there, but the difference is Florida does not have the increased deaths because that is part of the second wave, whatever you want to call it, the milder wave of the American epidemiological curve. Whereas in Arizona and California and Texas, and it's the southern counties, you are downright seeing serious cases and some more deaths. Not tremendous like New York, but you are seeing some more. Why? Because the virus didn't hit Mexico in earnest until May.
So let's get on to a little claims made in Daniel Smith's show and also the YouTube videos that Daniel Horowitz is in. The first claim being the Hong Kong flu of 1968 and the Asian flu of 57 is just like coronavirus. The second claim that Daniel mentions that is circulating around conservative blogs is that Woodstock happened during a pandemic. And there's a claim that says testing in the YouTube videos on One American News Network that testing increases cases. This is a lie that Trump is supporting. And the virus is coming over the southern border. This is completely crazy. And people in Florida are not dying as the virus has weakened even further. This is an interview that they did July 1st. And another claim is that that Daniel Horowitz makes in the blog post that Danielle read. It is implied that they imply that the common sense, so to speak, Henderson paper agrees with their viewpoints on school closures, masks, and lockdowns. So let's get into this. The first point, can COVID be compared to past pandemics? Like at some level, you always can compare, infection rates and things like that. But you can clearly see that the other pandemics have different factors, infection rates, mortality rates. Things change, especially over 50 years. And you can say that given COVID infections have maintained after all the mitigations applied, it is very likely that COVID is more infectious or more damaging. Either more people are getting getting COVID, or more people are adversely impacted. And you could say, like many conservative websites say, Sweden is letting it go and their death rate is not higher. But in fact, their death rate is higher. It's higher than their neighbors, Norway and Denmark and Finland. And it's also the case that among the Swedish population, you have voluntary compliance with various rules. Like here you can see, according to Google mobility data, that the transit stations, people visiting transit stations and workplaces are down 30%, down 60% compared to this. I believe the comparison is last year. So even though the government of Sweden has a more relaxed approach, or what they would call sustainable, you could say the Swedish population is complying with rules that they're following some sort of health guidance irrespective of the law. So in this case, you can say that again, coronavirus is either more infectious or more damaging at this point because we have applied mitigations even in Sweden. People are changing behavior, and the numbers of cases and the number of deaths is relatively high, and they've has outpaced the Hong Kong flu at this point, or will, adjusting for population, will soon. And getting into the second point, was Woodstock held during a pandemic? A quick cursory Google search says no. The Hong Kong flu of 68 happened in December of 68, and then by March 69, it had, without mitigations or without the mitigations that we're applying right now, had mostly, like you could say, burned out. But so then Woodstock happened, and then it flared up again November of that year. And you can see direct quotes from the organizers. The co-producer of Woodstock told Reuters, Woodstock was not partying in defiance of pandemic containment measures because at the time of Woodstock there was no pandemic and there was no containment measures to defy. There you go. It doesn't get simpler than this. So the Hong Kong flu happened in 2 waves, and the Woodstock Festival is not within either of them. Okay, now let's get into this claim about testing creates cases and this COVID hotspots map that was shown on One America News Network. Let's just rewatch that bit of the video and see where it goes.
Sure. I mean, this is the ultimate accounting gimmick. Look, what you're seeing in Florida is what a flat curve looks like. It's drawn out a little bit longer and very few deaths. But here's the broader thing. We had a major debate in March. Our side said, look, this virus is widespread, has long spread like the flu, and the good news is, therefore, the infection fatality rate is so much lower. The cases you're seeing in the hospital are the only serious cases. Everything else is either asymptomatic or very mild. So outside of nursing homes, this is really not more deadly than the flu, or certainly a bad flu season. Now we're finding the virus has weakened even further, so there's almost no deaths, even though there's tons of cases, and yet the media is like, hey, look at all these cases. We're going to die, and they're missing the point.
The hot spots right now, if we look on the map, there they are circled. You're looking at Arizona, southern Arizona in particular, southeastern California. You're looking at Houston, parts of Texas, and maybe parts of Florida. That southern zone. What is all in common with these states? That would be southeastern California, Arizona, and in particular, Houston. Oh, it's this crazy thing called the southern border.
And guess what? You threw in Florida there, but the difference is Florida does not have the increased deaths because that is part of the second wave, whatever you want to call it, the milder wave of the American epidemiological curve. Whereas in Arizona and California and Texas, and it's the southern counties, you are downright seeing serious cases and some more deaths. Not tremendous like New York, but you are seeing some more. Why? Because the virus didn't hit Mexico in earnest until May.
Okay, so we have the map that we were shown by One America News Network with these 5 hotspots, and the presenter is saying that he rattles off a bunch of them and claims that what they have in common is the southern border, when in fact on his own map you can quite clearly see there's only 2 of the 5 hotspots that are related to the southern border adjacent, right? So Northern California and Eastern Washington are not really in any way close to the southern border. And then furthermore, Daniel Horowitz goes on to say that the infections in Arizona and Texas are going to be worse because they came in a wave from Mexico, in his words, from May, whereas apparently, according to him, the the infection in Florida is going to be less deadly because it came from presumably the northeast United States. There's no evidence for this. He doesn't present any evidence for this. And then he goes on to say that the infections in Florida are less deadly than the infections, the hotspots in other places because it's part of what he calls the second American epidemiological wave. I mean, this is not something I've heard of in any other fashion. This is something that he seems to have completely made up. It would be interesting if any other sources talking about this, but we can see we don't really need to double check this as much because he's talking about this stuff in July, and we know what happened. He's talking in July 1st. So we know what happened in the data. So here's July 1st. He's talking about the bottom chart. The rolling 7-day average of deaths was 38 deaths a day, right? Now, he's saying that the early July case count spike did not correspond with deaths. And that's true because death is a lagging indicator, right? So he was saying that the Florida outbreak was less deadly. And here we see in the data that you can see, 2 weeks, 3 weeks, 4 weeks out, you have a spike in deaths, right? You have the spike in cases, right? And then you have the spike in deaths. So I don't know how he would go to explain all of this. I don't know what waves of the epidemiological pool Daniel Horowitz, the famous Twitter account haver, would say this is, but quite clearly deaths have spiked since he aired that prediction, and he looks quite ridiculous. But again, where to begin with these people? This is completely ridiculous. So if you have a wave in cases, you can expect a wave in deaths. Whether it's 2 weeks behind, 3 weeks behind, it usually depends on how well you're testing. And the testing is not creating cases, it's just creating this lagging indicator where you know about a case sooner than you would have otherwise, right? So April, February, March, April, when we knew about a case late, deaths and cases might coincide, but now we are testing sooner and you can expect deaths to be a lagging indicator. Remember, like people like Herman Cain spent a month in hospital. So that's 4 weeks, right? From testing positive to a fatality. But even though we know these things are facts, one thing that might change is the actual fatality rate, because as we know, or as we can presume, we are going to get better at treating the disease, and which will change the fatality rate. And we also have this idea that your exposure to the virus, how much you're exposed to the virus, in what context you're exposed to the virus matters. If you're singing in someone's face, or someone's singing in your face and they have coronavirus, if they're singing for half an hour in a choir practice, it's not a good way to get coronavirus, right? You want other people to be wearing masks so you don't get basically, spit in your eye, or you don't want someone spitting in your mouth. That's probably the worst way to get it. So you want other people to follow rules such that you don't, have to deal with so much of their junk. Now let's talk about this Henderson paper that's cited by Daniel Horowitz, and the one person that he says has a common sense approach to the pandemic response. So let's start by saying, it doesn't agree with any of the claims that Daniel's saying or making, and it doesn't really say much of anything that coincides with what they're saying. The paper is very anti-quarantine in the context of quarantine large groups of people. For example, if you have a number of people infected people on a cruise ship, it wouldn't make any sense to leave them quarantined on the boat. I think the Henderson paper points out that this is, from what everything written on the Henderson paper, the Henderson would say this is not really a disease containment approach that makes any practical sense. And we know after the fact that this didn't make any sense. Leaving people on boats just to get infected was not a great approach, even though it, in this case, it would have raised the number of infected people in the lower 48, and the president happened to be against it. It was not actually a disease containment strategy. But let's go and just read the paper directly. What does the paper say about masks, right? You can say, it says in the use of masks and personal protective equipment. Masks and other personal protective equipment are essential for controlling the transmission of influenza in hospitals, right? And then, it says patients would be advised to wear surgical masks to diminish the number of infectious respiratory particles being dispersed into air, thereby diminishing the likelihood of further spread. And then it continues to say, in Asia during the SARS period, many people in the affected communities wore surgical masks when in public, but studies have shown that ordinary surgical mask does little to prevent inhalation of small droplets bearing influenza virus. The pores in the mask become blocked by moisture from breathing, and the airstream simply diverts around the mask. There are few data available to support the efficacy of N95 or surgical masks outside a healthcare setting. N95 need to be fit tested to be efficacious and are uncomfortable to wear for more than an hour or two. More important, the supplies of such masks are too limited. It ensures that hospitals will have necessary reserves, right? So basically all of this coincides with everything that we've been hearing about don't waste N95 masks. And, if a conservative blogger was quoting this, they would quote the second paragraph and leave out the first, and I think the first is key, where it says patients would be advised to wear surgical masks to diminish the number of infectious respiratory particles being dispersed in the air, right? So the idea is masks do not protect you, but if you are pre-symptomatic and you are going to be potentially sick tomorrow, it prevents you from spitting particles all over the grocery store today. So it's not about protecting you. And this paragraph, on the second paragraph, bears it out, that it's not going to do much to protect you, but universal masking, due to the facts in the first paragraph, you need to diminish the number of infectious respiratory particles being dispersed into the air, because you don't know if you're infectious or not. And continuing, right? He goes on to talk about, let's just go over the entire conclusion, right? The following is a synopsis of the author's judgments regarding possible disease mitigation measures. Vaccinations. Vaccination is by far the most important preventative measure, but pandemic strain vaccine will not be available for at least the next season. Meanwhile, community-wide use of the seasonal influenza vaccine is desirable, as it is likely that outbreaks of seasonal flu will occur even if there is pandemic influenza. So Henderson loves vaccines, so that's good. And then provision, isolation, and medical care of influenza patients. Regional healthcare operations committees priority to ensure collaboration and cooperation across the community, both for advanced planning and during the epidemic, to assure that the large numbers of flu-infected patients can be cared for in hospital, at home, or in special facilities. Special arrangements are needed for expanding surgery capacity in hospitals and for support to permit home care of patients and for the provision of additional volunteer healthcare staff. So he's saying, you might need more hospitals and you might need to care for people in the home, right? Not everyone infected is going to be should be in the hospital setting. There you go. Open and frequent communications with the public are essential. This involves regular press conferences, hotlines, and provision of information through civic leaders, churches, schools, and businesses. An important message is to request that all who are ill remain isolated at home or in the hospital, but to encourage others to continue to or come to work so that essential services can be sustained. There you go. So open and frequent communications, and from Anthony Fauci, Birx, and other people that are saying masks are good. People like Daniel Horowitz and Daniel Smith are saying that these communications that are from health experts are somehow suspect. So this is undermining these public communications that from medical experts. And then this is the interesting part for right now. This paper actually talks about the closure of schools. It has been the practice in many communities to close the schools for up to 2 weeks at the beginning of epidemic of seasonal flu, primarily because the number of both teachers and pupils who are absent. Everyone's sick. They can't come to work anyway. They close the school. This is a reasonable initiative, often expected in many communities, that also serves to demonstrate action on the part of officials. Closing schools for longer periods in hopes of mitigating the epidemic by decreasing contacts among students is not warranted unless all other likely points of assembly are closed. For example, malls, fast food restaurants, churches, recreation centers, etc. Such widespread closures sustained throughout the pandemic would most certainly have serious adverse social and economic effects. So here, Henderson is saying, it doesn't make sense to close the schools unless everything else is closed. And guess what? With the situation we're at now, everything else is closed, right? There's no dine-in fast food restaurants is severely curtailed. I haven't seen a mall that's open, at least to the extent it was. Office parks are closed, bars are closed, churches are social distancing, recreation centers are closed all summer. So the idea that schools would be closed, I think, makes sense because in this context, he's saying, don't close schools unless everything else is closed. Well, everything else is closed. So in this context, it kind of defeats the purpose of closing all the offices if you're just going to open schools. And then he goes on to say, everyone should be encouraged to wash their hands after coming in contact with people who are ill and to cover their mouths when coughing or sneezing. And then he talks about canceling or postponing meetings with large numbers of people. So large gatherings are closed right now. So intuitively, this would appear to be helpful adjunct to reduce contacts among people and so to mitigate the effects of the epidemic. However, individuals normally have a great many contacts throughout the community on a daily basis, shopping in stores, attending church, traveling on public transport, and so on. Recognizing that the spread of influenza is primarily a person-to-person contact, any one individual, even a large gathering, would only have a limited number of close encounters with infected people. Thus, canceling or postponing large meetings would not likely have any significant effect on the development of the epidemic. While local concerns may result in the closure of particular events for logical reasons, a policy directing community-wide closure of public events seems inadvisable. Again, this advice is you're going to church, you're shopping in stores, you're traveling on public transport. If all of these contacts are also being curtailed, then it probably makes sense to curtail large events. So in that context, I don't think that anything Henderson's saying is contradictory to public guidance from health officials. But I'm sure conservative blogs will put their own spin on this, and I'm sure they will forget that this guidance is around influenza, which it's its own virus. Quarantine. As experience shows, there is no basis for recommending quarantine of either groups of individuals. The problems in implementing such measures are formidable, and secondary effects of absenteeism and community disruption, as well as possible adverse consequences such as loss of public trust in government and stigmatization and quarantine of people in groups are likely to be considerable. So you don't want to quarantine all of cruise ship passengers. It's probably not a good idea. And this is an interesting point that anti-immigration Daniel Horowitz doesn't get into. Screening passengers at borders or closing air or rail hubs. Experience has shown that these actions are not effective and could have serious adverse consequences, thus are not recommended. So he's saying do not bother closing your borders. So that's not something that's been done to complete extent, but I'm sure all these people that think the virus is a foreign entity would love to see the borders closed. An overriding principle, the experience has shown that communities faced with epidemics or other adverse events respond best with least anxiety when the normal social functioning of the community is least disrupted. Strong political and public health leadership is to provide reassurance and to ensure that all needed medical services are provided are critical elements. If either is seen to be less than optimal, a manageable epidemic could move towards catastrophe, right? So you need to project strong public health leadership, right? You can't have contradictory messages. You can't have the CDC saying one thing, the WHO saying one thing, and then the president saying something completely different. And for political reasons. And again, Daniel Horowitz thinks you can just politicize everything, make everything a political issue, and then he's an expert.
Dr. Osterholm, let me start with you. Is there any way we avoid what some people thought was alarmist a few weeks ago when Dr. Fauci said he was worried about 100,000 cases a day? Is it inevitable at this point that that's where we're headed in a couple of weeks?
Well, to put it into perspective, again, we look at where we've been. We have probably infected between 7 and 8% of the U.S. population to date. That's it. For all the pain, suffering, death, economic disruption, that's it. As we've talked about on this very show, this virus won't slow down even, let alone stop transmission until we get to 50 or 60%. To put that into some kind of perspective, Chuck, if we had 65,000 to 70,000 cases a day for the next 365 days, it would just begin to get us to that level. So we have a lot of human wood to burn in this coronavirus forest fire. And, we may see ups and downs in communities where people do take more concern for a moment because of the severe problems. But I think it's not only likely we're going to see much more than 100,000, but I don't think people understand if we don't change our ways, we are in for the next year of those very kinds of numbers.